So another thing that we talk about a lot is physical activity, and with good reason. So we know that physical activity is incredibly important for maintaining vascular health over time. We know that it's great for mood, and it can have many other benefits. One of the benefits we wanted to try to study was to see if physical activity was one of those potentially protective factors that kept people with high amyloid from developing memory loss over time. So we studied physical activity again in the Harvard Aging Brain Study. These are just the highlights. I'm happy to answer more questions about this. But what we saw was essentially that people that had higher levels of physical activity that also had high amyloid burden actually showed very little decline over time. So that's on the right-hand side. And what overall this pattern suggested was that people who had high amyloid burden in the brain and were at increased risk of decline, if they also had high levels of physical activity, they showed some protection, so there was less cognitive decline over time. And we could actually see that same pattern when we looked at brain tissue. So what these colorful kind of areas on the right are showing you are areas of the brain that showed increased cortical thickness, so there was basically more brain there, in people that had high amyloid burden and high physical activity versus high amyloid and low physical activity. So this is showing you in a very tangible way what the protection of physical activity might look like in a larger clinical trial.